Hey everyone. Sorry for the lateness on the video. Normally I try to post by Thursday at the latest, but it has been a doozy of a work week, and I'm actually going to bring in an ethical spotlight from this week, a few of them in this video. Regarding your work from last week, a lot of you integrated the feedback that I left on your assignment that we just did for credit, whether it was complete or incomplete, your assessment. I put a lot of feedback on those. So hopefully that really assisted you all. It seems that a lot of you integrated that feedback. It's also clear to me that some of you have more assessment experience than others. And just remember that assessment is a skill, but also an art. Not only are we learning what information is pertinent, what information needs to go in what section, what's redundant, what's concise. But when you're conducting assessments and you're sitting with folks, you're asking very private, personal information as a stranger normally, and trying to collect all this information while artfully weaving in the questions into a conversational flow as opposed to sitting behind a computer screen, not making much eye contact and just saying, what substances do you use? What is your trauma history? Blah, 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 blah. Those types of questions, you will learn nuanced language on how you ask them. You'll learn different skills on how to validate and make people feel safe as they disclose information. It happens all the time in home health where individuals maybe disclose sexual trauma for the first time. A couple months ago, I was working with a couple who had a plethora of relationship issues, and it ended up uh, getting disclosed that the wife in this relationship had been sexually abused for a length of time when she was a small child and had never told anyone. That level of a new disclosure also brings great risk to the discloser. Um, that can feel very unsafe to somebody, and it can exacerbate psychological symptoms. So, suicidality and HIPAA are very, very important and very hazy depending on the setting. So I'll give you an example of what happened this week to kind of highlight an ethical spotlight and HIPAA and how important HIPAA is. And so yesterday, I had a free afternoon, which is very rare as a home health social worker. And the only reason I had a free afternoon was because I was waiting on insurance authorizations, which can be a big barrier in home health. It can take 7 to 21 days to get an MSW assessment approval from an insurance company, and folks are usually only in home health for a minimum of 4 weeks and usually a maximum of 2 to 3 months. And so I got a call from a supervisor. A nurse had been with a patient and had given her the PHQ, the Patient Health Questionnaire, which is a standardized assessment of depression, and it has a suicide question on it. And the nurse found that the patient was actively suicidal. Nurses are not always trained in the Columbia suicide assessments or the assessment that comes after a positive uh, association of depression, or I'm not making much sense. If somebody says that they are suicidal, there are more questions that need to be asked. Is there a means? Is there a plan? Is there an intent? And nurses on my team usually do not get into that full suicide assessment. They call the social worker in. So that's what happened yesterday. They called me in to conduct the full suicide assessment. It was assessed that this woman, who was a 57-year-old woman who had had multiple accidents, was wheelchair bound, had a super intense trauma history, and had been actively using methamphetamine for many years, was actively suicidal, had the plan to go by means of pills. And because of all her chronic health conditions, she had a ton of pills at her disposal. And she had just gotten refills on all those because she was admitting to home health from the hospital. And she had the intent to carry it out and the means to do so. So this was very serious. It's sometimes the case where folks have vague suicidal ideation, meaning, I wish that I wouldn't wake up tomorrow, but I've never gotten so far to think about how I would do it, and I definitely would never do it because enter resilience factors. I couldn't live with myself if my wife found me. I don't want my grandchildren to know that I completed suicide. I can't live with the fact that that may affect them negatively. Um, my religion says that if I complete suicide, I'll go to hell. All of these are protective factors. If someone is vaguely suicidal, doesn't have a plan, doesn't have intent, and they have protective factors, you really assess that and hone in on those protective factors, discuss that with them, validate with them, create a strict safety plan, maybe have a medication plan. Maybe we only have 7 days of medication while we're in home health. That's totally easy to monitor because we might have a nurse in there multiple times a week who can dispense the medication as needed. You can also have pharmacies dispense medication as needed on safety plans. So, but she was not willing to do any of that. The situation also was that not only was she feeling like a burden and that she had no one in her life, the day prior, her and her son, who have a very intense trauma history rooted in her neglect and drug use when he was a child, had asked her to leave the residence and she didn't have anywhere to go. So this is a wheelchair bound woman who has chronic health issues and was going to basically be put on the sidewalk by her son. And so, she was just devastated. We were with her the nurse was with her for over 4 hours. I was there for 3. We really honed in on all protective factors, and since she was unwilling to safety plan, and we found a glimmer of hope that maybe there was area of opportunity for her medications, maybe there was area of opportunity to get her enrolled in a specialized behavioral health program that might assist her with housing. She was also living off of $600 a month because she doesn't have enough work credit history to get a big disability check. So just barriers and trauma galore. And so finally, she was willing to allow us to take her to the hospital. Now, we were in her son's house with the door closed, having, soft tones so that he wouldn't hear, and he was playing music loud and playing video games in the other room specifically to respect her privacy. But he did not know what was going on. He didn't know why there were multiple professionals. He didn't know why the nurse was there for 4 hours. He didn't know why a social worker all of a sudden showed up. And the patient was not feeling comfortable disclosing all of the information to him because she thought that it would make him more mad, that maybe he would think that she was doing this for attention or that she was doing this to get him to not kick her out, kind of a thing. I think that there is a history of that manipulative, resourceful type behavior with her substance use, and she had actually used methamphetamine that day as well, which could have impacted the way that she was presenting. She requested that I knock on his door and inform him that she was going to go to the hospital and that in a few minutes EMTs were going to come because we had called 911 for ambulance for her. The son asked me what was going on and almost just came out of my mouth, "Oh, she's suicidal and we need to get her to the hospital." Boom. That would have not been okay. It is okay to sometimes almost disclose information and to catch yourself because we were in the heat of the moment. That's a really stressful situation, trying to get somebody to not end their life for 3 hours. You're really in the thick of it with them. And it's emotionally exhausting and taxing for everybody involved, particularly the patient, but also for the clinicians. And so that when we're under that kind of emotional exhaustion after that type of a marathon, you need to be really mindful about everything that you say and disclose, because you can accidentally disclose information all the time in a situation like that where everyone's really close together. So it seems like it would be okay to disclose, but it's absolutely not. That was her private health information, and she did not explicitly tell me that I could tell him. So I said, she's just not feeling well. We are really concerned about her and we need to get her to a hospital for assessment. I didn't say anything about mental health. He knows she has chronic health conditions. And so he, assisted us in getting her into her wheelchair. The EMTs took her to a stretcher. She went to the hospital and he saw her out and then asked a few questions about whether or not home health was going to continue. We had to say that, she needs to go to the hospital, get assessed, and then maybe she's going to come back to us. But really intense situation that has implications for HIPAA, clinician self-care. I'm not going to lie to you guys. I came home yesterday and I saw a commercial and I started, bawling after that. And I said, okay, this is not about the commercial. This is about the emotional exhaustion of today. I took a bath. I don't use alcohol. So I drank some tea, some chamomile tea, and I really, really took care of myself yesterday evening. I reached out for support from, one of my friends just to kind of process the day, what I had been through. Went to bed, woke up feeling fine. If I would not have discharged some of that emotional energy from the events of yesterday on top of a really stressful work week and done all the things that I had done for self care, I would have swallowed all of that, right? And after years of that, that is destructive, toxic stress, and it surely makes us poor clinicians. Not talking poorly about any of my clinicians, but I'm sure all of you have had the experience of working with a clinician or having an experience with a clinician that has been in the game for multiple decades and maybe doesn't take care of themselves. And it's really, really visible, and not following the ethical code, right? Because we are obligated to take care of ourselves so that we can take care of our clients. Really intense week. Hope that this helps you all. As always, get at me with questions. I'm here to support you. Please talk to me about what you need. If you have any questions about my feedback, ethical spotlights, anything, I'm here for you all. Have a great week and a great weekend.